and thanks for joining us. Today we are here to discuss bioidentical hormone replacement therapy, also known as BHRT. This has been a real, the best way to describe it, it has really been a hot subject for a lot of folks. We have had hormone replacement therapy since the 1980s, when you go back to women being put on Premarin as one of the first hormone replacement medications. And, obviously to deal with menopause. So as we get closer toward 50, as for both males and females, women were noticing a lot more side effects and symptoms, hot flashes, mood swings, dealing with a lot of just changes as their cycles were ceasing. The human body goes through many cycles, one of them being women going through the age of childbearing years, typically starting at age 13 and going all the way up to right around 50. So during those times, we note that women have a cycle every 28 days, and as that cycle comes to an end and the childbearing years are ending, we get into perimenopause, menopause, and postmenopausal states. Now, the premenopausal states is when things first start changing, typically around 47, 48 years of age. We start noticing, I'm not feeling, the greatest, maybe more fatigued. Things are just not what they used to be, and their cycle starts to change. They start missing periods, and of course, a lot of women get very nervous. If they're married, is it a possibility that I'm pregnant? That wouldn't be the greatest thing for me. Oh, wait, no, that's not the case. I'm not pregnant. And what we notice is we're getting ready to go through the change, both men and women. Women in particular, we've noted more because we see more obvious changes, like the fact that their periods have stopped. And that typically starts right around the age 50. So the hormones have adjusted, and that is why the periods have stopped. So they don't have as much estrogen or progesterone, and at times their testosterone levels will go down. And that's right, you heard that correctly. Yes, women have testosterone levels the same as men. What we notice is all these start to change and they start to decrease. So when that happens, we see things like the fatigue, the decrease in sex drive or decreased libido. We also note things like hot flashes, mood swings, crying without any reasons, and so on like that. Men too go through these same changes. As they get closer to age 50, they start seeing a decrease in their own testosterone levels, and they start noticing that they have mood swings, that they have had decreased libido, that they have fatigued. Trying to lose weight becomes more of a challenge for both men and women. And we start seeing around the waist that stubborn fat not wanting to go away no matter how much we exercise. A lot of that can, when you get into the age bracket of the late 40s and early 50s, can be a possibility that your hormone levels are off, and that may be why you're not able to lose that extra, poundage around the gut, so on. That you're not as clear as you once were. You're fatigued. So all these fun symptoms can be related to hormonal changes. So people will go to the doctor and say, "Hey, I've got all these symptoms, hot flashes or fatigued or whatever the symptoms may be, the ones we just talked about." And one of the most prudent things to do is do some lab work. Okay, so we get some simple labs. What's important that sometimes gets missed is checking hormone levels. What is the estrogen level, progesterone, LH, FSH, testosterone? What are those levels? We first think of, we need to get a complete blood count. We need to check your kidney function, your liver function. Is the magnesium off? Yes, those are all very prudent. But when we talk about things like fatigue and like moodiness and, having symptoms like that, or having struggles with weight loss, even though we've been changing our diet, we've been, doing more exercise, but we're not seeing certain things. We really need to look at our hormone levels. So this is where we're going to, focus today and talk about some of these things. Is when we talk about hormone replacement, as I noted before, Premarin was our first choice, and that came out back in the 80s. Now, it was specifically for women. Men's health and hormone changes took a little bit longer to notice that, hey, guys were running into these same problems. They were a little bit more stoic and didn't say as much, where women were like, I can't handle these terrible hot flashes, and my husband's upset because I got the house and I'm at 60. And so when they were concerned about these things, they would see most of the time their OBGYN. Now, of course, their focus is on women's health. So they would be thinking, hey, are the hormones changing? And they were, treating them with, medications like Premarin or estrogen creams and so on. What we saw was Premarin is actually equine estrogen. It's not the same as utilizing, human estrogen. And when we talk about bioidentical hormone replacement therapy, we are now going and using straight estrogen, progesterone from Homo sapiens or human beings, and not equine or horse estrogens. So this has been a great advancement that's come in the last 20 years of using bioidentical hormone replacement as a means to controlling your symptoms. What we see more than anything else is for women that they are noticing that their mood swings are improving dramatically, their hot flashes are starting to improve, and they're having far less side effects. One of the things that would prevent people from being put on, especially women being put on a Premarin, is there was an increased risk of developing blood clots. Anyone who smoked, they were not really a candidate for hormone replacement because it gave an increased risk of developing blood clots that could lead to certainly, disastrous things, including, embolus in the lung or even the heart, which can obviously lead to death. So when we started looking at bioidentical hormone replacement, it became a real bonus. Again, smoking, of course, is never good for anyone, but the risk profile started going down, and the improvement of symptoms started going up. As men had started noticing more and more, hey, I'm not feeling the greatest, and personal trainers are going, hey, we've been doing this, we're not noticing what's going on here, and we started becoming more aware. What we saw is when the primary carers were running testosterone levels and saying, well, let me just check your testosterone. What they saw was, hey, maybe it was, quote, normal or in a normal range, but on a lower end. So if your normal range is 250 to 1200 and you're checking your testosterone, it's sitting at 300 at age, say, 50, but when you were in your 20s and 30s, your testosterone level was more like at 1,000. Now, there's certainly going to be some adjustments and changes. You're going to notice fatigue. You are going to notice a decrease in libido. You are going to start seeing, not being able to develop weight loss like you anticipated. The pouch around the stomach is still going to be there. So this became more of a thought. Hey, even though it's, quote, normal at, say, 300 or 350, if we increase it to when it was more closer to 1,000, when that man was in his 30s, would that change a lot of their symptoms? Of course, the thought is, yes, of course, it should. And when we did do that, that is what we noticed, that, hey, the fatigue was improving, the weight loss was starting to work, and it was really making a difference. So treatment options that are available for these, for the testosterone, for the estrogen, for the progesterone, traditionally have been, for men, injections or creams. And for women, the Premarin pill. As we started moving away from that, we started looking at creams, either topically or intravaginally, or again, possibly injections. One thing that has changed, though, more recently, is a new delivery method. When we use creams, they can become messy. You getting them rubbed in, it can attach to clothes. You don't usually get the full benefit like you'd really like, and they're kind of difficult to deal with. Injections, well, those are great. But what happens is you see this nice spike, oh, I feel really good, and then it wears off. Oh, I need to get another injection. So you feel really good, and then you drop, and then you feel really good, and then you drop. What we offer, and one of the things that we do, and we're not exclusive, there are plenty of others that do it as well, but what we offer is what's called a pellet system. And Kara and I have both had pellets placed and can tell you from our own personal experiences, and I'll let Kara share hers here in just a moment, the difference is night and day. And what I mean by that is pellets are literally what it sounds like, a small pellet-sized medication of estrogen and or testosterone that is placed underneath the skin and the subcutaneous fat, typically of the hip. It takes a few minutes to do in an office setting. It's very simple, small, tiny incision that doesn't even need a stitch. The pellets go right underneath the skin, and they last from 3 to 4 months before they need to be replaced. And what happens is that medication is slowly dispersed evenly from a rise and then an even pace straight across into the bloodstream where you don't have highs and lows. It's very nice. You don't think about it after it's done. You mark it on your calendar for your next visit, and it's easy peasy, set up and ready to go. What we've seen with the pellet system is it is such a huge advantage for a convenience and an even distribution of medication. No peaks and valleys, just an even disbursement of improvement in all of your symptoms, or typically a lot of your symptoms, the fatigue, the mood swings, the hot flashes, and so on. I know personally when I had the pellets done, I felt significantly better. I started noticing a lot of my pain was improved. I didn't have the aches like I used to. And I started feeling pretty gosh darn good. And again, the whole thing took about 5 minutes and it was done. I tell you, Kara, what was your experience and how have you felt since having the pellets done?
Well, it was, like you said, very easy procedure that, once they just insert the insertion device through a small cut in your skin. With the pellets are then inserted, they pull out. Your skin will heal up on its own. There's no stitches, like you said. So after it had been inserted, it took a while to feel the results. Some people feel them quickly. I did not feel it extremely quickly, but once I started feeling less aches and pains after a few weeks, and then more energy and just feeling overall generally feeling better, more, it's easier to get up in the morning and get moving. And so it really helps with a lot of overall aches, pains, just feeling of well-being kind of goes into the aging process. As we all get older, there's, the need to have different procedures, supplements, all these things to keep you feeling your best. What used to come naturally as the hormones change and we all age, it's not so easy. So there are a plethora of things that can be done, and a lot of which is our focus at Turning Point Wellness. Is we're trying to help you live your best life, feel your best, and we can't stop aging, but we can do what we can to make the process as smooth as possible. So, it really has been an easy transition to having the pellets, and so after about, is it 5 or 6 weeks, you have your
Typically 6 weeks.
6
yes.
weeks. You have your retest on your hormone levels, and then when it's time to have another insertion of pellets, that gives some information about how it's working for you as an individual, because everyone's different. Sure. Some people like to have a high testosterone level. Even some women, they feel better that way. Others like lower. So it gives you the information about where your levels are. You can, based on that, like, hey, I think I'd like to try a little higher level of testosterone next time. Or, I feel like maybe I need a little less. That's an interaction that the patient has with you as the provider to find the optimal level for them, because, there's a wide range of what is medically considered an acceptable range, but people fall in different areas based on their individual preference. So, it's a really great way to keep feeling your best and keep moving forward.
What's really nice, and Kara hit this right on the head, is we're not cookie cutters. All right, everyone's different. Everyone's going to have different levels, and things are going to feel different for each person individually. That is why it is so important to sit and discuss your symptoms that you've noticed, how long it's been going on, what you've seen, how you've felt. What changes did you try? What things have you done? All these become very important. The interview for the initial is very important to note. Hey, this is what I've been feeling. This is what I've noticed. Including things like, if you're a female, how many pregnancies have you had? How many live births? Have you ever had a miscarriage in the past? What have your hormone levels been previously? Have they been checked? Comparing these things becomes very important. So this is not it's not a sit down and, in 5 minutes we'll have this all figured out. This is something where you sit down and we talk through, hey, this is what I've been feeling. There's a formula that's put together, and it was put together by a great OBGYN to, get an idea of how much of the hormones we should be putting in, and get an idea of what estrogen level, what progesterone level, and what testosterone level. And that all comes from some of the lab work, as well as, probably even more importantly, our conversation, our interview, our discussion of your symptoms and what you've been feeling and how long. So these are all things that you need to, think through when you're talking about hormones, and when you're talking about, hey, I've had trouble feeling, not feeling my best, not feeling, like I've got, my energy levels are lower. These are all very important things to discuss prior to doing any kind of hormone replacement. That being said, again, as Kara had mentioned, the process is very simple. The procedure takes less than 10 minutes. There's no anesthesia. It's done right in an office. It's very low key, and most people tolerate it very, very well. There's a small amount of lidocaine used to numb the skin, make a quick incision, insert the pellets, and then using simple steri strips to close the wound, because it's very, 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 again, superficial. One of the key things that we talk about when we go back over and talk about our hormones and how we're feeling, we We see so many people that come in and say, hey, I'm here to talk to you about weight loss, and I know that you have a weight loss program, and yes, we do. But what else is going on? How long have you been working at the weight loss? Okay. How old are you again? Oh, you're at that age. You're in your 40s. You're in your early 50s. Have you noticed any other symptoms? Could your issues that you thought are, I'm having trouble losing weight, could it be your hormones aren't balanced? Sure, you may still need, additional assistance, but one thing we need to sit down and certainly discuss is, hey, what other symptoms have you had going on in your life? What sorts of things have else been have been happening? And that's where at Turning Point Wellness, we sit down and sort all these things through. We don't just say, oh, you need some, a diet plan, here you go. Here's the exercise plan. Let's get you on your way. No, we sit and we go through, hey, what else is going on in your life? What other changes have you noticed? What sorts of things have you been feeling? And that's part of the process in a wellness type environment and clinic is we talk about everything. We really try and sort through what all has been going on. I know Kara and I have talked about this multiple times, that when people come in, that one of the key things is, hey, let's read their body language. What are we noticing right off the bat? I know when Kara's had people to call on the phone, she's asked them lots of questions. I mean, some of your interview questions that you've talked about, I've heard, when I'm in another room is, so tell me more about, have you noticed a lot of fatigue? Have you noticed that you have maybe a little brain fog going on? Things aren't as clear. You're just not feeling the greatest, and it makes a difference. And it helps me certainly as she's doing, interviewing on the phone, get an idea of, hey, this person's going to come and just want to give you a heads up.
Yeah, and there's a lot of things that we can talk about of differentiating, because as you mentioned, there are numerous clinics that do the bioidentical hormone replacement, and even with the pellets. But we do have, we use a system called the Pellicome system. You would have seen the images on the screen of the insertion devices, and that really sets our system apart from a lot of places that use reusable insertion devices. Ours is a one-time use, and so it comes completely sterile from the factory. Everything is used only on an individual patient, and the way it's inserted, it goes to exactly the right depth and is very precise in its placement. So you can be assured that every time your pellets are inserted in the correct spot. We've heard horror stories of pellets not being inserted properly, coming out. That will never be a problem with the Pellicome system. So that's one of the things that the devices cost significantly more. While our services don't, we're
true.
Comparable with the other clinics out there, but we believe in providing a superior experience, and that will lead to superior results for the patient. So that's why we really believe in having the Pellicome system on board, and so that's going to ensure that you get your insertion in the right place, exactly what you need with the calculator. That's all of the information about what hormones you get is based on your initial blood test. So we're sure that based on your numbers, this should be right for you. And like I said, people have different tolerances, preferences on hormone levels. So that's just where all the numbers tell us optimally you should be on your hormones. But once you get them in there and you see how it feels, we can always adjust it for subsequent hormone insertions, because the pellets do need to be replaced. Your body absorbs them in 3 to 4 months. So after that time, you'll be back and get another insertion. And it's a maintenance thing that a lot of patients just find to be key to keeping their life as active as they want it to be and feeling as good as they possibly can.
Yeah, it's definitely a game changer for most people. Again, getting away from the creams, medications that are you have to remember taking daily injections. Those become kind of aggravating after a while. Constantly being stuck with a needle. This is so much more convenient and a lot easier to work with. And as Kara did note, the Pellicum system is pretty impressive. It always gets right to the right level. We get the insertion just underneath the skin and the fat layer, right where you want it to be, just above the muscle. Again, the incision is with a very special scalpel that they designed that only goes to the depth that we need. There's no guesswork at all, and that makes things so much easier in the end. Again, don't ignore certain things. Oh, it's just age related. I guess I'm just going to feel fatigued, or oh well, I guess I just have to deal with these hot flashes. No, come talk to us. Come and sit down. We'll walk you through. Let's see if we can sort some of this out. We'll check a few labs. We'll sort through what's going on with you. All right? You don't have to be a slave to the hot flashes, the fatigue, the brain fog. It doesn't have to be that way. If you sit and have a chat, we can come up with some ideas and thoughts and things we can do. We'll make sure of it. That's part of our job, is to sit and discuss with you all the things that you're trying to sort through.
Yep.
As we get here ready to wrap up, Kara, any last thoughts?
No, I think there's a lot we can do. We look forward to hearing from our viewers on how we can help them feel their best.
Absolutely. Well, thank you so much for listening. We appreciate it. Again, Turning Point Wellness, here to help you.